Study synopsis of the Pharm trial, indacateryl glycopyrronium versus salmeterol fluticasone for COPD. In the Pharm trial, this was a randomized double-blind, double-dummy, non-inferiority trial. There are about 3,300 patients enrolled who are 40 years and up with COPD and a history of at least one exacerbation during the previous year. This trial wanted to look at the treatment of a LABA-LAMA combination, indacateryl and glycopyrronium, versus the controller standard treatment, LABA-ICS, salmeterol, and fluticasone. The primary outcomes looked at the annual rate of all COPD exacerbations, and the secondary outcomes looked at the annual rate of moderate and severe exacerbations, as well as time to these events. The duration of the trial was 52 weeks. The typical patient had a mean age of 65 years, and the majority were male with a COPD severity grade of D. A little under 40% were current smokers, and a little over the majority were using inhaled glucocorticoids at screening. As we can tell from the baseline characteristics chart, both groups were similar with regards to prognostic factors. The results. The authors set the non-inferiority margin of 15%. This was to estimate a relative risk reduction of 13.75% for patients if they were treated with indacateryl glycopyrronium versus placebo. And the authors found that 13.75% reduction would be meaningful. The results of the trial showed that it was not only non-inferior, but also leaning towards superior. In the indacateryl glycopyrronium group, this showed an 11% reduction of annual rate for all COPD exacerbation, with the effect being as large as 17% or as small as 4%. The p-value is 0.003%, so results were statistically significant. In terms of adverse events and risk of death, they were both very similar in both groups, with the authors highlighting that pneumonia or the incidence of pneumonia was slightly higher in the LABA-ICS group than the LABA-LAMA group. In terms of risk of bias, the Pharm trial risk of bias was moderate. Allocation concealment, it wasn't clear whether or not concealment was done, but in terms of randomization, maintaining prognostic balance and blinding of all relevant parties, the study was low risk in those areas. However, the greatest risk of bias came with the funding bias, as the sponsor of this trial was Novartis Pharmaceuticals, which is the company that is behind the treatment indacateryl glycopyrronium. So the risk of bias is higher because of this. In conclusion, the Pharm trial was powered for a non-inferiority analysis, but the results showed superiority. And so the authors conclude that among patients with COPD who had a history of exacerbation during the previous years, that indacateryl glycopyrronium was consistently more effective than salmeterol fluticasone in preventing exacerbations and was associated with no detectable increase in adverse effects.